seat there. Nice to meet you all.
Nice to meet you.
Nice to meet you.
So we're all students from George Washington University. We're student physical therapists, and we're just going to ask you some questions today. Is that all right? Sure. Okay. So first off, we'd just like to introduce ourselves. My name is Ben Sorensen.
Aaron Dude.
Amy Connect. Mary Bush.
Good to meet you all.
Nice to meet you.
I'm just going to start with some background questions for you.
Okay.
So can you just clarify what your name is for us?
Geoff Palmer.
Geoff Palmer. Okay. And how would you like us to refer to you?
You can call me Jeff, that's fine.
Jeff is fine?
Mhm.
Okay. How old are you?
I'm 24.
24.
Oh, sorry, I am 40.
You're 40.
Yeah,
Okay.
that's it.
40 years old. Okay. And what's your birthday?
May 10.
May 10th. Okay. May 10th. Okay. And what language do you speak primarily?
English.
English. Okay. So what do you do for a living?
So I work for the IRS. I'm a program director.
Okay.
So pretty much like I spend most of my day at my desk.
Okay.
Which is kind of problematic. The reason I'm here is that I have back pain that started about 3 weeks ago.
Okay.
So when I'm at my desk all day, it really bothers me. And I can't do anything about it because that's my job, you know. So
Right.
that's really concerning. Yeah.
So does your job require you to just sit at your desk most of the time, or do you sit in meetings?
I'm pretty much at my desk. I'll try to get up like every hour or so, walk around like the floor, but really like I can't really leave for too long.
Okay. Okay. So what kind of roles do you have at home?
Well, I have 2 children. They're 10 and 12. I'm married, and we have a nice house. I like to garden. That's actually how I hurt my back when I was gardening 3 weeks ago. I was picking up a bag of mulch.
Okay.
But yeah, I like to garden. My kids like to go to soccer games, which I try to attend, but now it's a little bit more difficult.
Okay.
Things like that when I have free time.
Great. Okay. So you live with who do you live with? Do you live with your wife and kids?
Mm-hmm.
Okay. Do you live with any other friends or family?
No, it's just us.
Just us. Okay. Do you have any other friends or family close by, or?
Within driving distance, yeah, but not like immediately. Like I wouldn't walk to a friend's house. You know?
Okay. So how did you find out about our clinic?
I think I was referred by a friend.
My friend.
Yeah, yeah.
Had he been here before?
I'm not really sure, honestly. I think he heard of you guys and he said that I should just check it out. And since my back was bothering me so much, I figured it'd be worth it.
Okay.
Yeah.
What kind of learning style do you think you like best? Do you like hands-on, or do you like reading material?
Either or, really. It depends on what you guys are teaching me, you know? Yeah.
Okay.
Yeah.
That sounds great.
Yeah.
Okay. So I'm just going to ask you a couple questions about your medical history.
Mm-hmm.
So do you happen to have a history of cancer?
No cancer.
Okay. What about diabetes?
No diabetes.
High blood pressure?
I do have high blood pressure, and my parents do as well.
Okay.
Yeah.
And then what about high cholesterol?
No.
Okay. And then do you have a family history of like cancer or diabetes?
Well, yes, my family, both my parents have high blood pressure, and my dad has heart disease and high cholesterol as well.
Okay. Are you currently taking any medications?
I'm on a few. So I'm on a couple of Zoloft.
Okay.
Lopressor, I think that was for my high blood pressure.
Okay.
Xanax and Adderall. And on the side with work, I don't know if you guys consider like caffeine a drug, but lots of like energy drinks and coffee, things like that.
Okay.
Even like caffeine pills.
Okay.
And I'm also taking a leave for the back, which helps it a little bit, but it's not great. Yeah.
Okay. And then do you have any other past or current medical conditions we should be aware about? This could include like surgeries or hospitalizations.
No, nothing.
Okay.
Nothing really that I can
Any
think
other
of.
injuries?
No, this is really it.
Okay. Do you currently smoke?
No.
Okay. What about drink alcohol?
Like a couple beers on the weekend, not a lot.
Okay. How many would you say?
3 or 4 through a weekend.
Okay.
Yeah.
Have you ever used or abused drugs before?
No.
Okay. And then on a daily schedule, how would you rate your stress? 0 to 10. 0 being no stress at all, to 10 being the most stress.
Well, before the injury, maybe a little high. You know, with my job, I'm really controlling like a massive section of the IRS. But after this injury, it's become even worse. So
Okay.
you wanted me to rate it? I don't know, like
Yeah.
a 6 or 7 out of 10.
Okay. That's on a daily basis while
Yeah.
you're at work. What
Mhm.
about while you're at home?
It's better at home because I can walk around and things like that.
Okay.
So maybe like a 2 or a 3 at home.
Okay.
Yeah.
And then, are you feeling depressed lately?
Maybe a little after the injury, but not before. No,
Okay.
I wouldn't say so.
Okay. Awesome.
Okay, so you stated you're in here for low back pain, you
Mhm.
said? And you said it started about 3 weeks ago?
Mhm.
Okay. You also said you thought picking up that bag of mulch may have caused this issue?
Yeah, so I don't know if that's exactly the thing that did it, but I knew that I was out there gardening for maybe like an hour or two, and afterward I could really tell that something was wrong.
Okay.
So I'm assuming if that's what caused it, and that was 3 weeks ago, and it's really just been just as bad as when it started since then. It hasn't gotten any better.
How would you rate your pain? 0 being no pain, 10 being take me to the hospital.
Well, it kind of changes. So, like, if I'm sitting, like, even sitting now is kind of bothering me.
Mhm.
At worst, it could be, like, 6 out of 10 if I'm sitting, especially at work. When I walk around, it's better. Maybe, like, a 2 or a 1. And in the morning, it's a little bit better.
Okay.
But, yeah, I can't always be on my feet, you know.
How would you describe your pain?
It's kind of like a deep aching, but certain things can trigger it. Like, if I bend over too far, or sometimes if I bend forward when I'm going up the stairs, it's, like, sharp.
Okay.
But normally, it's just kind of, like, deep in there.
Is it worse at a certain point in the day?
I wouldn't say it's worse at any point, but it's better in the morning.
Okay.
I guess it would be worse at night.
Are you having any trouble with any of the usual activities you used to do because of it?
Yeah, I guess so. I mean, I'm pretty much at work all day.
Mhm.
I do like to go to my kids' soccer games, and that's a little bit more difficult because walking makes it better, but running doesn't work out. So when I'm trying to coach them, it makes it a lot harder for sure.
Okay.
Things like that. And obviously, I'm not gardening anymore.
What's your home environment like?
Like my house, like where I
Yeah,
live.
like how's it set up? Are there stairs?
Yeah, so
rooms?
I'm in a 2-floor house with a basement, and yeah, there's stairs to go up and down.
Okay.
So yeah, like I sleep upstairs, but I have to go downstairs for everything else.
Okay. Does climbing stairs bother it?
It can sometimes if I lean like forward when I'm trying to go up them, but yeah, they're not the best.
You said you sit at a desk all day at work, right?
Yeah.
How do you get to and from work?
I drive,
You drive?
and yeah, that's kind of painful too because I have to sit there for like 40 minutes to an hour, you know. So yeah, not the best.
Okay.
Is this the first time that you've had back pain?
Yeah. Mhm.
You don't have any other conditions in your back that you've been diagnosed with?
No, really just this injury is the first time I've had problems with it, yeah.
Okay. I know you mentioned a bunch of things that make it worse. Is there anything else that makes it better?
Advil or Aleve helps a little bit. I've been putting a warm pack on it, and they sort of work, but it's really not the best. I think it's the best in the morning when I'm walking around.
Okay.
But nothing's really like cured it, you know.
Is it affecting your sleep at all?
Not really. It's really when I'm awake there's a problem.
Have you had any prior treatment for your back?
No, like I said, this is like the first time I've injured it, so this will be the first.
Okay. And you said it was staying the same over the 3 weeks. It hasn't been getting better or worse.
Yeah, it's pretty much been just as bad as when it started.
Okay. Have you ever been to physical therapy before?
No, this will be the first time.
Okay. Do you know what physical therapy is?
I mean, I understand you guys deal with pain and like exercise and things like that, and I was recommended, but I've never had it, so I can't be sure. So, I mean, like, what do you guys normally do with patients like me, like people with back pain?
Yeah, we can do some different kind of mobilization to try to loosen up some of the musculoskeletal system that can be having issues.
Mm-hmm.
We'll do a thorough exam to try to figure out maybe what parts of the body are involved in your issues. And we can definitely give you some exercise, strengthen up those muscles, do some flexibility exercises.
Okay. So, like, for someone like me, like, how long does something like this normally take? You know, I'm not coming out of the hospital or anything.
It really depends on what we find in the exam and how the treatment goes, so it really depends.
Okay. So I guess we'll figure that out as we go.
Yeah, we'll be able to give you more information later.
Okay.
And then what are your goals for physical therapy?
Really just making like work easier, like reducing this pain, because my job is awful, and then when I go home, like I want to see my kids, I want to be able to play soccer with them and coach them, and I can't really do that, because of the pain. So just everything's just limited, I want to get back to being able to be myself, really just being able to enjoy my free time more than I currently am,
Okay. Anyone else have any other questions?
No, I don't think so.
All right. Well, it was great talking to you today. Thank you so much for your time.
Yeah, good meeting with you guys.
Thanks for coming.
Thank you.
Thank you.
All right.